because of the hyperflexion, you expect injury around the C spine. So a key area that you want to assess is the C spine. And again, we say as they are going up and over, but again they'll be pushed forward. So you have the steering wheel will come and hit the chest. And when that happens, expect injuries at the chest region. A common injury that happens for the drivers because of the steering wheel is the paper bag effect. Hello and welcome to EMS-AFRICA. My name is Patrick Thoya, and in our today's discussion, our focus will be on the types of motor vehicle crashes. In the importance of this topic is to give you a clue or a guidance. Whenever you're responding to any kind of crash, you're able to predict what are some of these injuries this person might have sustained based on the types of a crash, the type of a crash. And without much wasting time, as I said, we'll be discussing on the 5 different types of crashes. Before we name the different types of crashes, I want us to look at which are some of the different factors that you want to consider as you're responding to this call. So number one factor that you want to put in is, of course, the position of the occupant. The position that occupant was occupying matters a lot in relation to that type of an impact. That is, if it's a rear end, of course we know those on the frontal seats will sustain significant injuries. And again, when it is a rear end impact, those at the back of the seat will sustain significant injury. So the position matters a lot. Another number 2 factor is, of course, the use and non-use of a restraint. Those who are using restraints, there's a very big difference when you compare with those who are not on their restraint. That is, for example, if someone was on a belt, we expect there's a pattern of injury that they're going to sustain, and most of the time, those who are not using seat belts or restraints, they sustain significant mechanism of injury that is than those with restraint. But as we all know, the restraints also come up with different injuries, but we can compare the differences in the two. When you compare the advantage of restraint and those without restraint, then the difference normally, those we have more advantages when you use restraint than when you don't have a restraint. Again, number 3 factor that I want us to look, you have to factor in is the type of a crash. Very important. Whether rear end, frontal impact, the type of a crash will determine the injury sustained, the pattern of how this person is going to sustain the injury. But this will form our discussion as we discuss each type of a crash and the injuries, predictable injuries in each. Okay, so without wasting much time, let's look at the types of the crashes. Okay, we have number 1 is the head-on impact or head-on crash. Apart from number 2, we have the lateral impact, as you can see the angle of that vehicle. Apart from that, we have the rollover impact. We can also have the rear end crash. Okay, and apart from that, we have the angular impact, as you can see that the vehicle is being hit at an angle, and that will make the vehicle to rotate. Okay, those are 5 main types of crashes. But now let's look at each type of a crash and what are some of the predictable injuries in each of these 5. Okay, let's start with the number 1. And our number 1 is on the head-on collision. In the head-on collision, normally when these occupants are not restrained, they are not on the safe belt, there are 2 pathways that they are going to move on that when that impact happens. And these 2 pathways, it can either be the down and under, or if it's not the down and under pathway, then we can have another pathway that is this patient is going to move up and over. That is the up and over pathway. Those are the 2 main pathways that they normally move. I want us to look at if they're going to move the down and under pathway, which is some of the predictable injuries. How will this person sustain the injuries? So number 1 of the things you need to pick here is when they're moving on the down and under, the knee will come with the first part of the body to hit the dashboard from this impact. So from that, what you expect is this, you expect injuries at the knee at that point. So assessment should be done here. Again, when that happens, this force is going to be transmitted in direct force. It's going to be transmitted to the to the pelvic area. So as this force is being transmitted, remember the femur is long bone and it cannot sustain much of the force. So you realize that it becomes vulnerable. So we expect to have a fracture along the femur. Okay. So if it's not the femur, if this force gets transmitted to the pelvic area, then we can also have injury at the pelvic. Pelvic fracture can happen. But remember, as this force is being transmitted, again, we said this person is going to move down and under, but remember, he's also going to be pushed forward. So what do you expect? The steering wheel will come and hit the chest or the abdomen. So another key area to assess is around the abdomen area or at the chest. Okay, that is the down and under pathway. So you want to assess those key areas as discussed there. But now let's look, if it's not the down and under, if this person is going to move up and over, how will the injury be sustained in such a pathway? So what happens here is the first thing to hit the interior of the vehicle is the head will come and hit the windscreen. Yeah? So what happens? You expect injuries to happen at the head, at the skull, like that. Then of course expect head injury, that the deceleration can be, the force can be transmitted to the brain, and expect injuries to the head. But another area, when this person is going to hit, this neck is not going to be fixed. It is going to hyperflex. Because of the hyperflexion, you expect injury around the C-spine. So a key area that you want to assess is the C-spine. And again, we say as they are going up and over, but again they'll be pushed forward. So you have the steering wheel will come and hit the chest. And when that happens, expect injuries at the chest region. A common injury that happens for the drivers because of the steering wheel is the paper bag effect. What happens here is, as they are hitting on the steering, what happens is, normally before this impact happens, when they see that they are about to cause that accident, or this impact is about to happen, in the process of defending themselves, they normally take a deep breath in. So they fill their lungs with air. So at the point of impact, the lung is filled with air. So when the impact comes, the compression force, it will force the lungs to rupture because they're filled with air. So an injury commonly known as the paper bag effect, which we say it is the most cause of the thoraxes in such an impact. Okay, so that was the down and under impact that we said. Remember the pathway here too, up and over and down and under. So whichever that happens, they know the injury, how they be sustained, and that will inform you where to assess. Okay, let's look at the second type of impact, and this is the lateral impact. As you can see in this picture, this vehicle, this impact, most people commonly refer it as the T-junction impact. Mostly, most of the time it happens at a junction, and that's, I think, why they say it's a T-junction impact. Okay, so in this, what will happen? So for this person, for this vehicle, you realize that this will be a head-on collision. So if you're assessing occupants from this vehicle, refer to what we discussed in the first impact, that is the head-on impact. But now for this vehicle, this will be a lateral impact. And in this, what happens? What are the pattern of injuries? So those occupants that will be occupying on this side of the impact, of course, we expect them to sustain significant injury than those on the other side. Okay, it's not that the other occupants will be affected. Remember, force will be transmitted, and again, they can sustain injuries. But expect much of the force will be exerted here. That is, those occupants at that point will sustain significant injuries. And as you can see, when the impact is there, of course, the body will move towards where the impact was. The head will hit the interior of the vehicle. We expect injuries around the head. Remember, the neck is going to flex. The injuries can happen at the C-spine. Remember, the shoulder, the clavicle, the ribs, assess for the kidney and the pelvic area, the femur, all those area close to that. But again, remember, don't just focus here. Do your complete assessment. Remember, this force is going to be transmitted to the other area. So we expect we can also have injuries to the other area. Okay, so that is the lateral impact. Those occupants close to the impact, give them a high priority, or you expect them to have significant injuries. Let's look at the third type of a crash, and that is a rollover impact or a rollover crash. So what happens here? For this kind of a crash, you cannot predict the injuries that will be sustained in that crash. Why? Because as the vehicle is rolling, it depends on that. If the person was using a restraint, again, if they're not using restraint, how are they going to hit the how many times this vehicle is going to roll, and how many times they're going to hit the interior of that vehicle. So injuries in this cannot be predicted. So how do you know the injuries? Most of the time, you get the injuries. That is, in this you rely much on your assessment, physical assessment. Do a detailed assessment to find out that is, this is a multiple trauma system. Okay, so one thing to add here is you expect this type of a crash, it has the highest number of ejection. That is, you need to do a good scene size up so that you are sure that there's no other occupant who has been ejected. Okay, so now from there, let's look at the fourth type of impact, and that is the rear end impact. The rear end impact. As you can see from this, if it's a rear end for the red vehicle, as again we can say this is a frontal impact for the red vehicle. But now for this yellow vehicle, that would be a rear end impact. So if assessing, one thing you need to note is if the impact is from here, you realize that this occupant will be moved. There will be much movement along the neck. Okay, an injury called a whiplash injury. That is, there will be movement of the neck. That is, we expect injury at the C-spine, especially those occupants that they don't have a headrest will be much vulnerable. So much assess the C-spine, but again, if they're not restrained again, the way they're going to be moved, the same way we discussed on the head-on impact, if they're not restrained, they can also move. Occupants in that vehicle can move in that pathway again. So that's how we go about that type of a crash. And then the last type of a crash we can say about is the angular impact, where for this vehicle is going to be, it will be, as you can see, it will be hit here at the angle. So you expect the vehicle to rotate. It can be either on that side or at the rear, towards the rear end at an angle, and then the vehicle normally rotates. As that is happening, then normally the occupants are being, they can hit the interior of the vehicle. So injuries will depend. So that you have to do your assessment. Thank you very much. Those are the type of impact that we say. So we have the 5, that is head-on, lateral, rollover. We have the rear end, and then we have the angular impact. And in each, we have discussed on how the injuries will be sustained. Hope this information will help you, especially when you're responding to any type of a crash. Once you have any information, you have in your head, you know what are some of the predictable injuries that you expect, and that will help you to inform on which areas to assess, and that means you'll have good outcome to this patient as you're managing. Thank you very much, and if you've not subscribed to my channel, kindly do so. And thank you, and I hope to see you in my next video. Thank you very much.